Well, our debt to people on the front lines of this crisis, providing critical care, continues to mount as the pandemic shows no signs of stopping. And sometimes we can forget just how many people it takes to provide care for each other. And in a health crisis like this, it is all hands on deck. Dr. Randall Moore is the CEO of the American Association of Nurse Anesthetists, a group with nearly 60,000 members, many of whom are serving on the front lines, caring for patients with coronavirus. Dr. Moore, thank you so much for joining us. What do these nurse anesthetists, and I'm sorry if I'm butchering the pronunciation, what do they do, and why is it critically important now?
Good morning. Thank you for having me. Well, nurse anesthetists are advanced clinicians. They're advanced practice nurses. Our expertise, it really aligns very well with the care that these patients need. So think about the critically ill COVID-19 patient many of them require, unfortunately, to be intubated and put on ventilators. Nurse anesthetists, that is our expertise, that's our forte. Doing intubation. Also, managing critically ill patients our background is critical care nurses, and then we move into the operating room and surrounding areas as anesthetists, but we do have a very strong background in critical care nursing. And then you add into that, the work that we do in managing, putting in invasive lines, arterial lines, central lines, and managing these complex patients. Many of our nurse anesthetists are on the front lines right now doing all of those things.
So, how do they use their skill sets to repurpose devices as ventilators? That I find so fascinating.
Right. It's extraordinary. If you would have told me 6 weeks ago we were talking about using anesthesia machines as ventilators in the ICU for critically ill patients, I would have told you were nuts. But COVID-19 has changed a lot of what we're doing and what we're thinking. So when you go into an operating room, if you're having a surgery, it's not common for us to use an anesthesia machine, which has a ventilator on it. So nurse anesthetists are now redeploying or repurposing those anesthesia machines as ventilator for patients who require mechanical ventilation. And the reason why we're doing that is because, as you know, there's a huge demand for ventilators, and we're using the ventilators that we typically use in the operating room in some cases if the facility has run out of the traditional ventilator that's used for those patients.
CRNAs are also providing some really important care services for patients, many of whom are isolated and they are alone right now. Can you talk a little bit about that?
Yeah, this is one of those things where you think about the human tragedy associated with COVID-19 is profound. And it's not just the impact on the patients, it's the impact on the families too. And so proud of our members because many of them now are in the critical care units and hospitals all across these countries. And yes, they're providing advanced medical care right now, but they're also there to support the patient and their family. So I've talked to so many members, and we have so many stories of nurse anesthetists at the bedside, with an iPhone or an iPad, or holding a patient's hand, some of which unfortunately expire. And it really is, I think, a testament to the fact that, even though we are advanced practice professionals, we also come from a critical care and nursing background.
Absolutely. What kind of feedback have you heard from these frontline workers about the continued need for PPE beyond just masks and gloves?
Yeah. It's still, unfortunately, a huge problem. And we're I guess about 6 weeks into this crisis, and the fact that we still have nurse anesthetists and other healthcare professionals that don't have the adequate supply of PPE, I think is a scandal, to be perfectly honest with you. I just this week talked to one of my members who's in a hospital that's been using the same N95 mask for a month. Now, as you know, those masks are intended to be single use and disposed of after that use. Now we have members and other healthcare professionals who are using the same masks for over a month. And that is, I think, a huge problem. And because it exposes our members and other healthcare professionals to risk. It is, I think, a testament to some of the challenges we have in the infrastructure of this country, and something we really need to have a serious conversation about when this thing is over and done with.
Do you think that we're doing enough to compensate medical workers who are risking their lives every day to save others? Of course, this is their job, but to your point, I mean, they don't sign up to go into a
You know,
situation where they're not actually being protected.
the answer is no. I don't, and I'll give you an analogy. So, I'm a retired officer in the United States Army. I went to war, and when I went to Afghanistan, I was given the training and I was given the equipment that I needed to protect myself and to protect my battle buddies. Now we have healthcare professionals on the front lines in a very different war, but it's a war, and many of them don't have the equipment that they need, and they're exposing themselves and unfortunately their families to this disease. And I think they do. I think they do deserve additional compensation. In the Army we called it hazard duty pay, and I think that we need to have a serious conversation about how do we demonstrate. We talk a big game about the heroes on the front lines, and not just nurse anesthetists. I'm talking about the people, the housekeepers, the people who work in the cafeteria in the hospitals, the physicians, the nurses. We talk a big game about how they're the heroes and how we want to support them. Well, let's talk about how can you support them when people are taking additional risk. And I think part of that is hazard duty pay.
All right. Thank you so much, Dr. Randall Moore, CEO of the American Association of Nurse Anesthetists. Thank you. Really appreciate your insight.